Every 40 seconds, someone in the world has a stroke. But how many of us truly know what to do when it happens? Today, we are shedding light on a critical health issue that can affect anyone at any time. The brain attack we call a stroke. Understanding this medical emergency is not just important. It's a crucial piece of knowledge that can save a life and preserve a future. A stroke occurs when the blood supply to part of your brain is interrupted or reduced, preventing brain tissue from getting the oxygen and nutrients it needs. Brain cells begin to die in minutes, which is why immediate action is so vital. To effectively combat a stroke, we must first understand its nature. There are two main types of stroke, each with a different cause. The most common is an ischemic stroke, which happens when a blood vessel supplying blood to the brain is obstructed, much like a blockage in a pipe. This accounts for the vast majority of all strokes. The second type is a hemorrhagic stroke, which occurs when a weakened blood vessel in the brain ruptures and bleeds into the surrounding brain tissue. Both types are medical emergencies that damage brain cells, but recognizing the signs is the first step toward getting help. This is where the simple and powerful acronym FAST comes into play. It provides an easy way to remember and identify the most common symptoms of a stroke. F is for face drooping. Ask the person to smile and see if one side of their face droops or is numb. A is for arm weakness. Ask them to raise both arms and check if one arm drifts downward. S is for speech difficulty. Is their speech slurred? Are they unable to speak, or are they hard to understand? Ask them to repeat a simple sentence to check. Finally, T is for time to call emergency services. If you see any of these signs, even if the symptoms go away, it's time to call for help immediately. While knowing the signs is critical for emergency response, understanding how to prevent a stroke is equally important for long-term health. Several key risk factors can increase your likelihood of having a stroke, including high blood pressure, high cholesterol, smoking, obesity, and diabetes. Many of these can be managed through lifestyle changes such as maintaining a healthy diet, engaging in regular physical activity, quitting smoking, and limiting alcohol consumption. Regular medical checkups are also essential to monitor and control these risk factors before they lead to a catastrophic event. In the event a stroke does occur, modern medicine offers hope for treatment and recovery. For an ischemic stroke, doctors may administer clot-busting drugs that can restore blood flow, but these are most effective when given within a few hours of the first symptoms. For some hemorrhagic strokes, surgery may be necessary to stop the bleeding and relieve pressure on the brain. Following initial treatment, the journey of recovery begins. Rehabilitation is a cornerstone of this process, involving therapies such as physical therapy to regain strength and coordination, occupational therapy to relearn daily activities, and speech therapy to recover communication skills. Recovery is a marathon, not a sprint, but with dedication and support, many stroke survivors can regain their independence and quality of life. By understanding what a stroke is, recognizing the FAST signs, and embracing preventive measures, we can dramatically change outcomes. Every moment saved is brain function preserved, and every healthy choice made is a step away from this devastating condition. Let's work together to spread awareness and empower our communities with the knowledge to act swiftly and decisively against stroke. Thank you for watching.